Hello, and welcome to the Chronic Pain Experience podcast. I am your host and chronic pain recovery coach, Dina Chopoulos. Tune in as I explore the complexities of pain, the reason why you might be living in stubborn pain, and the tools and techniques to help you on your way to living life well, naturally. In the last two episodes, if you've tuned in, we talked about why you hurt so much, why you're not getting better, and in this episode, we're going to cover off what it is you can actually do about it. So if you have not tuned in to episode 1 or episode 2, please go ahead and do that first, as it's the important context that you'll need to be able to follow along in this podcast. So let's dive into it. So in our previous podcast, just as a quick review, if it's been some time since you've listened to them, chronic pain is complex and multi-systemed. We talked about those who are more prone to chronic pain. Because we are highly adaptable and bioplastic, our biology changes when you live with pain, or this hypervigilance that we see as a result of living with pain for some time. We explored the symptoms of sensitization. We explored the obstacles to recovery. We talked about the changes we see in our sensors. We also talked a lot about that we are in a constant state of change and correction biologically, psychologically, and social. And that's the good news. We know that things can change. Feelings and beliefs are also nerve impulses too. In this episode, we're going to explore what to do about stubborn pain. We're going to talk about examples of what we see with the changes to our nervous system. We're going to explore treatment types. What does recovery actually look and feel like? We'll clarify the different ways to work with the nervous system. We're going to pull together what we know of pain now and recommend a formula for recovery based on the latest pain research. And finally, I will tell you a little bit more about my 16-week Change Pain Academy. So number 1, some examples of changes we see for those who live with chronic pain. And this is not just hearsay. This is based on the research that's been happening for the last 20 years on pain. First of all, we see changes in the brain. Due to the changes in our nervous system as a result of living with pain for some time, we get worse at discerning or deciding between our left and right sides. Now, this is something you won't necessarily notice on your own, or maybe you have. I know I struggle with it sometimes when I'm on a computer and I'm trying to work with a client to decide if that's a left or right side. Sometimes when I'm watching others do things too, I really have to work at deciding quickly, is that a left side or is that a right side, without overthinking about it. And this is one of the changes we see. We also see changes in perception. So in certain chronic pain conditions, we see the brain perceiving body parts differently. So a great example of this is complex regional pain syndrome. And so if you were to ask someone who lived with CRPS if they would be able to draw a picture of the limb that is in pain or the part that's in pain, oftentimes it's very difficult for them to draw a reasonable representation of what that limb actually looks like. We see changes in regulatory processes, so the way our body feels to us relates closely to how the immune and autonomic systems regulate it. And so, as I mentioned in the other episodes, the pain system as well as the immune system work very closely together. And so it can be really difficult to relate closely to how our regulatory processes are working. We have this almost disconnection between brain and body. We also see, of course, you likely know this already, but changes to movement. So when you are in pain, you move differently. No big surprise. But when you expect to be in pain, you move differently too. It's just another way your body and brain tries to protect you because our brain and our nervous system are highly anticipatory and predictive. So they're trying to protect you by predicting based on experiences that you've had not to move a certain way. Number 2, exploring different treatment types. So far, which of these have helped you with your pain long term? Is it physical therapy, chiropractic care, surgery, injections or other procedures, weight loss, prescription meds, massage, TENS units, acupuncture, or hot cold therapy? If you've said yes to a couple of these that have helped long term, then that's great news. But if you are inside your head right now thinking, I've tried many of those and not many of them have offered long-term relief. Yes, some short-term relief, but it's really not on the big picture doing it for me. And if that's you, you're not alone. This is very common when we are dealing purely with the biological aspect, that we're not necessarily getting to the underlying issue to help you long term. Failed treatments tell us a lot about what's going on with your underlying cause, potentially, of the pain. And so it's just another clue that we can look for to help us assess if we are dealing with sensitization, which we talked about a little bit in episode 2 of our podcast series. So if you remember, we talked about in the last episode that there are 3 important pieces of the pie. There's the structural and mechanical, there's the nervous system, and there's also the mind and body. And in the center of all of that is your pain, or the pain you feel. So if we're only dealing with the structural and the mechanical, then you will still have pain. If we're only dealing with the mind body, i.e., meditation, mindfulness, CBT or cognitive behavioral therapy, they're all good. But if we're just focusing on that, we may not get to the root of the problem. And alternately as well, if we're only dealing with the nervous system, i.e. only seeing a chiropractor or only doing the dysregulation work, then you will likely still have pain. So we need to pull those 3 pieces together. Why treatments you have tried so far may not have worked. So treatments are designed to solve a particular part of the pain problem. Different treatments solve different problems. And we can categorize each of the things you've tried by the type of problem it solves. So for example, if you have inflammation, you may have been prescribed anti-inflammatory diets. If you have low back degeneration, they may try to offer spinal surgery. If you are experiencing relentless pain, they might try and give you a nerve block to help that pain feel like a whole lot less. But we're going to try and categorize these things by the type of problem it solves. So, number 1, there's 4 different types: pain intensity, structural or mechanical, mind-body methods, and changes in the nervous system. Treatments that address the pain intensity are things like the medications, the TENS machine, or injections, blocks, and ablations. And so they might help short term, but essentially, if they're not getting the job done, it's really just a Band-Aid approach. And this comes from Dr. Alyssa Wolf. I love her analogy. She says, if you were in a room where the music was turned up way too loud, our current solution is to put earplugs in to remedy it. So it is dialing down that volume, but is it actually getting rid of the problem? And if you take those earplugs out, you're still going to hear the loud volume, right? So really, it's a great way to describe that it's not addressing the underlying issue as well as it could be. If the treatments that address the pain you feel are not working, we need to go to a deeper level. And the treatments that address structural and mechanical, and you're likely very aware of these because this tends to be the way our medical model will direct you to next, things like physiotherapy for joint stability or functionality, chiropractic care for nerve health and alignment, surgery, weight loss. These are all great if we are dealing with a structural issue. But if we are dealing with either a mind-body issue or a nervous system issue, these are not necessarily going to give you the long-term results that you're looking for. So again, this is just more data for us to assess, is there something else going on under the hood, so to speak? Is there something else we can do to help with all of these symptoms, really? And the analogy again from Dr. Alyssa Wolf is if you have a tricky light in your home that works sometimes and other times not, Often, if our solution is just replacing that light bulb, then that's not going to necessarily get rid of the electrical problem that your house is experiencing. This is a helpful way to really explain that frustration you feel when you've trying all the things you're telling you to do, but they're not giving you the long-term relief. Okay? It really is oftentimes a deeper dive that we need to do. So we need to address ultimately the nervous system. Treatments that address the mind body, just so that we're covering off all the bases here, is that cognitive behavioral therapy and dealing with our thinking, stress response, so mindfulness based stress reduction courses you may have heard about, dealing with our mental health, talk therapy, the Curable app, which deals with pain reprocessing, meditation, journaling. And then there's regulating versus retraining. So I just want to spend a moment here because I think you've probably heard a lot of these terms dropped and not known what they mean. What's the difference? What's the best for me? So regulating a dysregulated nervous system is often the term we use for when you are stuck in the fight or flight response or stuck in the collapse and shut down. Or if you're highly anxious, this nervous system becomes a little dysregulated. So, working with a dysregulated nervous system is different than retraining a sensitized nervous system. Whereas the retraining is really working with the biological changes we see to your neurobiology. And so it takes different treatment protocol than working with a dysregulated nervous system. So essentially, the work that I do, along with Dr. Alyssa Wolf, is we work to retrain the nervous system as opposed to trying to regulate a dysregulated nervous system. And again, if these mind-body pieces are helping but not doing all of the work for you, again, that's just more data for us. We are going to be highly suspicious that you are dealing with a nervous system problem instead of just a structural or mechanical problem. And so ultimately, the missing ingredient so far is the nervous system because we know sensitization is a problem. Physicians, researchers are very convinced that overactive pain pathways are creating this stuckness in pain, this stubborn pain that all that you do is just not getting better. We absolutely need to address the nervous system. Treatments that address the changes to our nervous system. Okay. We need to start off with pain education because the more you understand about what's going on inside the body, the more you can do the work that's necessary to help you get back to a state of joy, happiness, back to a life well lived. We do things called bottom-up drills or this peripheral work. So I'll explain this in a moment. We do top-down drills, which is working from the brain downwards. This is where we retrain the brain. We do work on left-right discrepancy, because if you remember earlier, I mentioned that that's one of the changes we see to part of the brain is this difficulty in discerning between left and right side. Motor imagery, sensory discrimination, and mirror therapy. So these are all science-backed, researched treatment protocols that can be used to change or to work with the changes in our neurobiology that we see as a result of living with pain for some time. Just to go back to what I mentioned a moment ago, the approach to working with your nervous system is very much a bottom-up approach and a top-down. When we're talking about the bottom up, we're talking about your peripheral nervous system. So sensations in the hands, sensory work with the parts of the body. The top down is where we are actually doing the work within the brain and its interpretation or perception of pain. What does recovery actually look and feel like? This is an important thing to keep in mind. Recovery from pain looks different for everybody. Just like everyone's pain story is unique to them, very much like a thumbprint, recovery is also going to look different for people as well. There are things we can do that have some overlap from person to person, but there is always going to be tweaking. There's always going to be things, little changes we can make per person to help them further along on their path to recovery. Recovery could look like I'm back to work now, or I'm able to play with my grandkids without the pain crash, or the pain is just a white noise in the background. I can finally travel now. I no longer feel pain. I no longer live in fear. So these are all very different outcomes and very different descriptions of recovery. And for everyone, it's going to be different. So please notice and hear that we're not saying everyone's going to feel no pain at the end of the process, but some do. But many are feeling like they can live with a small amount of pain that they have left over, that residual stuff. Plus, more importantly, you will be given the tools to that you can use for the rest of your life. Recovery takes time and patience. And you've not been given this before. Oftentimes, in our medical model, and to no fault of their own, if they see someone in pain, they are caring, compassionate people. They want you to feel better. And so their approach, rightly so, up front, is to give you the medication to help you feel less pain. But the problem is, it is a short-term measure, and it does not necessarily give you that long-term relief. If we're talking about recovery, we need to understand that it takes time and patience, and I would even add daily practice. Recovery takes work. So if it took time for our brains to change due to the pain that you live with, it's going to take time to unravel all of those behaviors, thoughts, patterns from pain into something that is less pain provoking. And as I mentioned before, recovery requires daily practice. And again, the reason why it takes daily practice is when you live with pain, your brain is creating these pain pathways that become quite hard set. And so to unwind that, to create new neural pathways, we need to allow the time and space to practice daily so that we can create these new neural pathways. Practice drills for just minutes a day. The good news is it doesn't have to take a ton of time, and sometimes it can be fun. Experience growth beyond just the pain. So I love this part about the recovery process. Yes, it's work. Yes, it takes time and patience and persistence. However, as you are doing the work, you are learning a whole bunch of amazing things about yourself, not just about your biology, but so much more than that. It is a growth experience, and it is a strengths-based approach to chronic pain recovery, which I think is really important because we've lost that strength-based approach in the way that we treat chronic pain right now. And unfortunately, it leads to our chronic pain community being desperate for those who can help them in the moment. For example, if someone lives with chronic pain and their doctor goes away on vacation and the pain comes on hard, you're left in a really bad place. You're not able to help yourself because you have to wait for that doctor to re-prescribe the medication and then for the pharmacy to put that through their process. There is so much growth in a process here, and it's about gaining agency over your own health and well-being and your own life and your own chronic pain experience. Oh, okay, finally, you've been waiting, you've been more than patient. Now I want to share with you the recovery formula that I use and other people use as well. Here are the essential components for chronic pain recovery based on 20 years of research into the mechanics of chronic pain neuroscience, chronic pain treatment, and in human health and behavior change, because it all comes together when we're talking about chronic pain recovery. So here is the breakdown of the components. There's these precursors, which I'll explain more about in a moment, pain education, pain foundations. So really, another way to think of your pain foundations is we want to create an ecosystem that is best suited for recovery. We're going to retrain the nervous system from the bottom up and the top down. Coaching, believe it or not, coaching is an integral part of the chronic pain recovery process. Why? Because it is a chance to be accountable to someone else. It's a chance to go deeper with some thought-provoking questions. It's also an opportunity for you, again, to experience that agency over your own health. It's not someone telling you what to do. It's you coming up with the solutions with the help of a coach that best suit your situation. As a matter of fact, some of the top researchers are saying a coach is actually a really helpful tool in your recovery. And of course, support. Whether it be support from family and loved ones, whether it be from your coach, whether it be from other people who are going through very much the same as you are. And finally, accountability. Because we are dealing with changes in behavior, changes in thought, changes in movement patterns, it's really great to have someone that you can check in regularly with to just keep you accountable, to keep you moving forward. And then finally, community. I think community is always, always a really big part of A, the chronic pain experience, but also, most importantly, B, the recovery process. So it's one thing to have a community around you that you can commiserate with and feel like you're not alone in this situation, but it can go so much further than that. It can now become someone that you can lean into. It can also be, leaning into, but learning from those who have either come through recovery or are doing the same thing as you are. And I promised I would talk to you a little bit more about what the precursors are, and this is important. Before we ever get started on the recovery process, we need to rule out any red flags that need to be addressed. First and foremost, I will never assume that you are dealing with a nervous system problem over anything else. The process always begins by first seeing your physician and just specialist, whatever, and seeing if the red flags are showing up or not. Now, sometimes when you get your imaging back and the doctors are saying, you know what, it looks fine. I'm not sure why you're still in pain. That is when we step in and that's when we start to do the work. Understand what kind of pain you have. So is it an acute issue that we're dealing with? Is there still damage to the tissue? Are we now in chronic pain? Are we dealing with a nervous system problem? So again, the clarity gained up front is really important. What are we dealing with? So that we can treat accordingly. Obviously, if there is a red flag, that treatment protocol to address the red flag is going to be first and foremost. But the good news is you can still do some of the other work to help with the pain in general while you are addressing that acute issue. And if you still have pain, we need to evaluate if you indeed have a sensitization issue or not, so that we can again have that clarity to move forward. And then it's good to articulate what it is you want. Or in other words, what do you want life to look and feel like when you're feeling better? It's good to have that future forward thought. Okay, what is it that I want? Beyond just feeling better. I mean, that's a big one. That's an important one for sure. But what is it you want to do? If you felt better, if pain was not such a prominent noise in the front of your forehead there, always, always with you, what would you be doing? And then finally, the last step is to assess if you are dealing with that sensitization, okay? And that is, I do offer a masterclass regularly on that called Untangling Chronic Pain, where we really get down to the nitty-gritty and assess, not diagnose, but just assess, could you possibly be dealing with these overactive pain pathways or this hypervigilance or this sensitization? They all kind of fit into the same category. So the next step then, of course, is to teach you about pain in a way that makes sense so you can make informed choices about your care. You can even speak to your doctor differently if they are informed about chronic pain. Not all doctors are, but many of them are getting there because understanding pain changes pain. It's not going to take the pain away by any means, but it certainly does help when you understand the mechanics, at least the very fundamentals of pain. And by being here and by tuning into these last 3 podcast episodes, you have learned a whole lot more about your pain and what's going on underneath the hood, so to speak. Pain fundamentals, we need to address our emotional and thinking saboteurs to your recovery. Fear, resentment, perfectionism, people-pleasing, this all or nothing approach, anxiety, depression, this negative bias, all of these things, because thoughts are nerve impulses too. And so if we're not addressing our thoughts and our beliefs, then, and that's part of that mind-body piece, then we're not going to get better. We also want to build a flare strategy that is both preventative and ready to go at a moment's notice. And so this is the work that we do inside the 16-week Change Pain Academy, we set you up first with the things that you need to help you have longer term successful outcomes. And also, we need to address sleep because sleep affects pain and pain affects sleep. And if we're not sleeping, we're not healing. We're going to retrain the nervous system. So when chronic pain changes our neurobiology, we need to address it by rewiring our pain pathways through nervous system drills so that we can reduce the strength of our pain pathways so our nervous system can accurately assess threats. So the body and brain get back to speaking the same language again. This dissociation that we see, or this disconnection that we see, similar to trauma, also happens with chronic pain. There's many changes that happen to our brain that create this disconnection. We need to get you moving safely and confidently with meaningful activities to build resilience and get you back to the activities you once loved. And it's so much more than just telling you to go to a yoga class. Nope. Instead, because that sounds fearful in itself, instead, what we're going to do is we're going to take movements that create a sense of fear in your brain, body, nervous system, and we're going to break that down and we're going to slowly introduce it incrementally so that your brain and your nervous system feel safe. And we do it in a way that is both research backed and, what's the word I'm looking for? Kind. It's not just throwing you back at it, it's really a gentle reintroduction. We need to teach you how to pace so that we are moving away from that boom or bust mentality or the all or nothing cycles and pain crashes. We will gently expose you to movements and activities or experiences to build confidence and to build belief in yourself and to reduce pain long term. This is often where we get tripped up because pacing can be a very challenging thing when you really don't have the guidance. Okay, what am I supposed to be doing here? How much pain am I supposed to feel when I'm working out or moving? What activity can I do? Especially when movement provokes pain, but also provokes fear. Inside the Change Pain Academy, we offer loads and loads of support. So remember, whether you believe or not that you are getting appropriate healthcare impacts your pain. I could talk a little while about support, but what's important about support is who do you have around you? If you have loved ones who may not understand what you're going through with pain, but are absolutely supportive to help you on your path to recovery, that's awesome. If you, for any reason, feel like you're not getting the appropriate care, whether it be around you, from family or loved ones or employers, or from the medical model, if they're just not feeling like they're giving you the support you need, that is also going to amplify your pain. And so that's why support is a very important part of recovery. Having those around you who understand how pain works, but also can help guide you through it. So that might be your physician. They may be one of the rare ones who do have a good, solid background in chronic pain recovery, not just management, but recovery. Or it could be your coach, or it could be the 16-week Change Pain Academy. There are lots of options out there. It's just a matter of finding what works for you. And we all need a little expert guidance to help navigate the work required. So when your doctor is telling you there's nothing more we can do, it's nothing more they can do. But there is certainly a whole lot more that you can do. And it is also very handy to have accountability to stay on track. Receiving and giving support to others going through the same thing as you is also a beautiful part of the recovery process. And one thing that we like to do inside the 16-week Change Pain Academy is really rely on you, the chronic pain warrior, but you are the expert. And so you can lean into each other in a way that helps you to move forward. And also, if you can have clarity through daily actionable steps that rewire the brain safely and effectively, build self-efficacy, that belief that you are capable, and offer you a clear path forward. And that is exactly why I created the 16-week Change Pain Academy. And I'm guessing this looks and feels and sounds a little different than what you've experienced so far with your chronic pain care. And one of the things I often hear is, well, if my doctor hasn't told me about it, it must not be effective. And I would lovingly push back and say, nope, the reason why your doctor does not talk about it is because they're just not informed about this. We have robust research, and it's still coming through, on the most complicated of chronic pain conditions having good results through a different type of treatment, different than what your physicians are currently talking about right now. So that's the hope. And so right now, my guess is you've only been offered the precursors. So not the pain education, not the foundations, not the retraining the nervous system, not the coaching, not the support, not the accountability, maybe the community. That's great if you have. But the precursors are, of course, the ruling out the red flags, understanding what kind of pain you have, whether it's acute, chronic, if it's a nervous system problem, a treatment protocol to address the red flag. That's important. That's all part of the precursors and where we start from. Where we tend to stop is if you still have pain, that's when the deal ends. They don't know what to do next. And so what we can do is evaluate really easily if we are potentially dealing with a sensitization issue. Okay, so we are missing, you are getting the top 3 of all of this process, but we need to take it much further than that. Just a quick little check-in now that you've tuned in and listened to the whole thing. Thank you so much for being patient. But I would love to just know what's coming to mind for you. Is it the importance of pain education? Is it how different this recovery path looks like compared to what you've known in the past or what you've been told previously? Or maybe it's how little support you are actually receiving in our current model of care. Or maybe your brain is thinking this seems a little overwhelming. And that could be possible too, and completely normal. Or your brain might be telling you, okay, finally, this makes sense, and it's making me feel a little more hopeful. Okay, so now that you have this information, it's important to know, okay, what do I do next? If you are at the point where you are ready to truly make change, I'm going to just touch base, if it's okay with you, a little bit about what we do inside the Change Pain Academy. So what is this 16-week Change Pain Academy? Well, it's a 16-week transformational experience, thoughtfully curated with evidence-based practices and research-backed protocols to change your pain naturally. And I am honestly, the more research I do, I am seeing that this is the gap that needs to be filled, considering that 1 in 5 people, and it's likely higher than that, experience this sensitization and are not hearing anything about it. It is also a step-by-step process to help guide you through the must-haves of chronic pain recovery based on the new science of pain. And if you recall from our first episode, we touched base a little bit on the difference between this newer version of pain, what we know now, compared to what we thought for hundreds of years. We've come a long way, and it's really just happening in the last 25 years or so. The 16-week Change Pain Academy is also a safe space in which to learn, grow, and implement new skills and evidence-based strategies together. It is a clear pathway to recovery. It's a step-by-step science-based program designed to help you desensitize your nervous system, reduce chronic pain, and regain control of your life. It's an empowering community where you'll connect with others who understand your experience while learning tools to transform pain into progress. And again, these are skills that you're going to use for the rest of your life. It's a holistic approach to pain reduction. So we address the physical, the emotional, psychological aspects of pain, combining techniques like graded motor imagery, mindset work, sleep strategies, and flare-up planning. And finally, it's an opportunity to rewire your brain and body. Through practical exercises and education, you'll retrain overactive pain pathways and rebuild safety in many things like movement, thoughts, and sensations. So you can get back to the things that you enjoy doing. And finally, it's a program backed by neuroscience and real results. Based on the latest evidence in pain science and neuroplasticity, the Academy provides proven strategies to foster long-term change. It is a learning and doing experience where each module you will learn new skill sets to implement on a daily basis. What it's not a quick fix. Chronic pain recovery takes time and consistent effort. This program is about sustainable progress, not instant results. It's not a one-size-fits-all solution. While the tools are effective for many, this program respects your individuality and helps you tailor strategies that align with your life and your values. So as I mentioned earlier, a lot of the things we do have a lot of overlap from person to person. However, we do need to tweak significantly, potentially, throughout the process. And so that's where we can make it more aligned with what it is you need and what your pain story is. And what it's not is an overwhelming flood of information. Each lesson builds incrementally with clear guidance to ensure you're never overloaded or left wondering what to do next. And it's not solely focused on pain relief. Whereas that's what you'll find in the medical model, which is helpful. This is much different. While reducing pain is a primary goal, this program emphasizes building a meaningful, purpose-driven life, regardless of where you are on your recovery journey. So, what does it look like on the inside? Well, I'm going to give you a really brief rundown before I let you go. Essentially, it is self-paced learning. Each week, you get a little bit more content that you tune into, consume the content, you start practicing whatever that practice is for the week. And then we come together once a week for an hour to do the live coaching sessions. We also then have other opportunities sprinkled throughout the 16 weeks where you get to connect with other people going through the process. And it's a great resource to connect and learn from each other. Because I know giving back as much as receiving is very helpful in the recovery process. And then finally, the thing that's really important is it is 16 weeks and we're covering off a fair amount of content at a slow incremental pace. But at the end of 16 weeks, it is my hope that you notice some change. You may not be exactly where you need to be yet at 16 weeks because if you've lived with pain for some time, it will take time to unwind. However, you have the tools you need. You have everything in place. It's just a matter of practicing and persistence to keep that going. Okay? We have other options as well to keep you going if you need that support, but it is a very good place to start and know what you need to know to help carry you forward. So here's what I want you to do. Head to my website. There's a link in the show notes for you. And the very first step there is to take the quiz to see if we are dealing with a sensitization issue. And if we are, great, we've got something to work with. Okay, that's the hope. And the next step is you can always set up a free strategy call with me where we will connect. It's the best place to figure out where are you now, what has worked, what hasn't worked, and are we dealing with a sensitized nervous system, and what to do about it. Please take advantage of that. That is a great way to learn about each other, to learn more about your pain and your pain story, and then offer what next steps could be. Thank you so much for tuning in, as always, for remaining curious, and we'll see you on the next episode.